Hello.
Hi,
So nice to see all of you.
likewise.
Awesome. So I'll just go ahead and get started because I have a lot of information to share and I've just started recording. And I'm hoping I can get through everything in the time frame. And there'll be some space for questions at the end. So if you could hold your questions until the end, that would be great. You can drop it in the chat anytime. I won't check it until the end if I can figure out how to do it. um, and I'm really hoping my internet connection's stable enough to last as well. Been so many hiccups in this lead up, but we're all here now. So welcome. I'm so glad that you're here. So I'm calling this presentation a sacred return because that's kind of what it is. It's a return to something that was bypassed. And it's a conversation that should have been available to you from the very beginning. Um, so, just before we get any further, I just want to be very clear about the scope of practice. So, my name's Hadija, obviously, I should have said that earlier. And I'm a certified Ayurvedic postpartum doula. And I live in Adelaide, South Australia. So I practice here. I work with women during pregnancy and postpartum, and I work with women virtually all around the world, but mainly in the Maldives because that's my focus. And yeah, so I'm here because there's not much out there for women who are wanting to birth with some sort of say in your own birth, because we all know when you enter the hospital system, it's a very different reality to what you might be expecting. So I'm here because women deserve more information around this. And yeah, so I'll explain more as we go along. So I'm just looking off to my notes because I don't want to forget anything. I tend to get a little bit like deer in the headlights. Yeah, so I'd love to know more about you. So drop it in the chat or just, yeah, let me know if you're actively considering a VBAC. So let's go on a scale of 1 to 5. If you're like how strongly you're drawn towards having a VBAC this time, with 5 being the strongest. Yes, definitely, I'm going for a VBAC. And 1 is obviously like, I'm not sure, I need more information. Now, where's the chat? Someone has mentioned something. 4. Awesome. Nice. Okay. So, so I want to tell you about the main reason, the main thing that draws me here today. And it's not what you might think, it's about a person. So, I want to tell you about the woman who showed me why this work matters. So, she was one of my very earliest clients from the Maldives. She is a pediatrician, highly specialized, medically trained woman. She had also been working in the labor wards in hospitals in the Maldives and attending births. So she knew how the system worked from the inside. So this was my client. Excuse me. And she was seeing some really horrific things inside the system. And she had also had her first birth was a cesarean section. She had been overseas. And basically, what happened was she felt rushed during her labor and she was basically caught up in the cascade of interventions. And, this is what she told me in her own words when we started working together. She said, I know I could have had a natural birth. I knew I could do it if I'd been given the chance. So she felt like she wasn't given that opportunity. And she'd also had two older sisters who'd both gone for a VBAC and successfully had VBACs in the Maldives. So she had seen it happen and she knew it was possible. So she didn't come to me saying, can I VBAC? Or am I allowed to VBAC? She came to me to prepare for VBAC. She had already decided. So that's why I want to tell you about her because this is important in this particular line of work that we're doing. So her confidence in her ability to VBAC didn't come from me. I didn't do anything to make her as confident as she was. It came from her level of education. It came from her understanding of birth, of physiological birth, and how birth preparation was crucial to having a VBAC. She knew the stages of labor. She was prepared mentally. And she didn't outsource any of her decisions. She was involved right from the beginning in every single medical decision that came her way. So she was in charge from day one. And my role was simply just to walk alongside her and help her understand what birth was going to feel like because she hadn't actually given birth before. She had had a cesarean, right? So I talked her through the language, the emotional landscape of labor, and Ayurvedic birth preparation. And she went on to have a successful VBAC at Treetop Hospital in the Maldives. She made decisions on the spot whilst birth was happening, and the staff respected her decisions, and she was allowed to birth in the way that she wanted to. And do you know what? It changed her life. I watched her transform, and that's why I'm here. This is why I'm here to inspire you with her story to say it is completely possible. So let's just take a look at why women go for VBAC. So firstly, it's a healing thing. After a cesarean the first time, especially if it was a traumatic experience, maybe it was unplanned or out of your control, women want the chance to meet birth differently. They don't want to erase what happened, but they want to move forward in the next birth. They don't want to just bypass birth as something that's too hard. Another reason is autonomy. So being an active participant in your own birth, to be making decisions about your own body, that's one of the reasons why women decide to VBAC. And the third is just to have a different birth experience, a different recovery experience, to experience what birth actually feels like. Because, and we're going to talk about this in this session, birth is an initiation. And all of these reasons, you might be here for all of these reasons, or one, or some of them, or none of them. It doesn't matter, really. At the end of the day, all the options deserve to be supported. Whether you choose to have a VBAC, whether you choose to have a repeat C-section, whether you're going for just, a vaginal birth in general, you deserve to be supported. Now, the biggest reason for me why VBAC is so important is because that initiation of birth that gets bypassed, sometimes unnecessarily, sometimes with good reason, there's something that's lost in that. And when we return to that, we have the opportunity to reclaim that. So that's why I'm calling this session Reclaiming Birth, or because that's what it is, So I just want to also make some space here because we are talking about birth, and there is a lot of trauma in birth itself. I mean, we know it to be a very intense experience, but in terms of what women experience, it's very traumatic. I get told birth stories by women from the Maldives on Instagram, and honestly, I leave those chats traumatized myself. I'm shaking sometimes because of what women go through. So if your birth was difficult, if you had a traumatic experience, I want you to know that the grief you feel, those feelings that don't leave your body, that's valid. There's no, it's not something to be dismissed because it speaks of a loss of an experience that you maybe had been planning for and hoping for would be different. Um, it simply might be that feeling of being outside of your control. Everything was outside of your control. All of these things deserve to be held and felt. So, coming here, preparing for this birth, educating yourself, you've already stepped onto the path of healing. So, you're already on that journey. Congratulations, you are on the path, you are continuing. And well done. It takes courage to be here. Honestly, as I've shared on social media before, women who are inspired to VBAC, especially in an environment that is not supportive, like in the Maldives, you are incredibly brave to begin with to want this experience. So yeah. Okay, so you've probably been told that having a repeat C-section is your safest option. So let's just take another look at that for a minute, because who is that safety for? And is that the actual picture? Is that the full story? And who is benefiting from that narrative? Now, I'm not trying to attack doctors. I'm not going against medical advice. As I mentioned earlier, the scope of practice, none of this is medical advice. I'm not in a position to give you medical advice. I'm not a medical professional, but I can give you honest information based upon evidence. And there are providers within the system that will not support VBAC, but then there are also providers who will. But the problem that arises is the system itself is kind of stacked against women, unfortunately. And they don't always put your individual well-being or even your basic human rights at the center of what's happening. And that's not like, I'm not trying to, I'm not going against the hospital system, but we need to have our eyes open when we are walking into this. We can't just be like, la, 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 can't hear this, can't see it, not going to speak about it. That's not my position at all. And that's not why I'm here, because I'm speaking to you woman to woman as someone who is working with women. And I see the best experiences come through women who take charge of their own birth, who do experience sovereignty and autonomy and control over their birth rather than being dismissed. So, there's a lot more nuance, is what I'm trying to say, to just, you've had one C-section, now you must forever have C-sections for the rest of your life. So, and that information isn't often given to you by the medical providers. So that's why I'm here, and that's why Mothers of Maldives exists. So let's look at the case for VBAC. So for well-selected candidates, VBAC has a success rate of 60 to 80%. Now, that is huge, That's not a small number. And one of the things that you can experience through having a VBAC, and what women experience, is faster recovery. So you don't need to heal from major abdominal surgery if you have a VBAC, whilst trying to feed and care for a newborn. You get to experience the hormonal cascade of labor, more or less, and we'll talk about this down the track, which is, oxytocin, endorphins for the pain, adrenaline at the moment of birth. All of this supports immediate bonding and that neurological transition to motherhood. And breastfeeding is much better supported through vaginal birth and the experience of having a VBAC. So the hormonal cascade, particularly that oxytocin surge at the moment of birth, that's what supports the milk coming in. So no wonder women who have C-sections often struggle with breastfeeding because the body hasn't gone through those stages to get to the breastfeeding. We've kind of just, blanked out part of it. And in the Maldives, we have epidemic levels of breastfeeding failure, and the connection is not being made at all. We also have lower long-term surgical risk, as in, risk of future surgical complications. And this is my personal addition to this, which is all around that initiation, the threshold, crossing the threshold of motherhood. So let's look at that a little bit in detail. So birth is not just a physical event, it is a transformation. In Ayurveda, we understand this as the crossing from one state of being to another. The woman who enters labor and the mother that emerges after, they're not the same woman. Something happens in between. And that has everything to do with how physiologically those hormones surge through the body in waves. The body is opened. We do something really incredible. And oxytocin is the hormone of love. So, and then we get this endorphin rush. So we get this altered state of consciousness. And this is something I teach my clients about, how having a physiological birth, you experience this state of altered consciousness and what you can expect at each stage and how to support it, basically. It's really cool. I'm such a nerd when it comes to birth. And, the thing that my client described when she was preparing for her VBAC, the most healing thing that she did was not just the birth itself, but the preparation work, the decision she made, that affirmation that my body can do this and I'm going to try. Okay, now let's look at the more serious aspects of this. So the medical system, as much as we would like to see it as monolithic, there are extraordinary providers within it. As I said, my client had a successful VBAC in the Maldives, and I have spoken with other women who have also said that they have had supportive providers in the Maldives. So they are out there. But we need to understand how the system operates, because this is, a general presentation. I don't know your individual circumstances or which hospital, which provider you're going with. All I can do is give you the most broad picture of this as possible. So there is this thing that is called the evidence practice gap. Basically, there are guidelines that support VBAC to be safe, global guidelines, safe and appropriate for many women. As I mentioned earlier, 60 to 80% of women who try are successful. But what happens when it meets clinical practice? It lags behind. The evidence, basically what's operating under clinical practice in a lot of the hospitals in the Maldives, is many years behind the current evidence, sometimes decades. So we've got staffing pressures, not enough staff, no continuity of care, which is now emerging as one of the most key factors in women having successful, empowering births. Not enough midwives, not enough nurses, not enough. We have this defensive sort of approach to medicine where you're recommended to go with a repeat cesarean right from the get-go. And it's not because it's the best option, but it's because the option that protects the hospital legally. And that's not a good reason to let that run your birth. And interventions that are being carried out in hospitals as routine are being carried out outside of their clinical indications. So things like continuous fetal monitoring, which is currently coming up as increasing the risk of C-section, like exponentially increases your risk of C-section. Even things like early admission, going in too early, that can increase your intervention risk, basically. So they all have consequences and they compound over the course of labor because we get caught in what is called the cascade of interventions. And this is not about blaming anyone. This is about knowing the terrain. This is about going in and orienting yourself to the landscape that you are arriving in. That's very important if you're going in as a woman about to give birth. You need to know that you're going in with the safest possible environment that you can. Now, we're going to talk about this. Hold on, I'm getting ahead of myself. So let's go to the next slide. Okay, so why do I talk a lot about C-section rates being dangerous? Because the actual recommended rate of C-section by the WHO itself is 10 to 15% for that population. Currently, we are sitting at over 60%, I believe. And the most recent information I can find is from 2016. There is a paper from 2016, 10 years ago, when it was already over 40%. Now it has most definitely overtaken vaginal birth. Now, I know it says 21% is the current global rate, but I honestly don't think that's an accurate number because just from it's very different what comes up when you put something into the internet and ask it to find the numbers. When you speak to people on the ground, and I speak to midwives, birth workers on the ground in places like the UK, places like the US, all around the world. It is higher than 21%, most definitely. And in the UK, at least, vaginal births are now the minority. Now, this is also frightening. In some parts of the Maldives, in the regional parts of the Maldives, now the cesarean rate is 95%. And there is a very good reason for why this happens. And this comes from this 2016 paper that I was talking about earlier, that I read, which was written by a Maldivian woman who was investigating why the rate of C-section is way above the recommended rate by the WHO. One of the reasons is that women have their first birth is a C-section. Then they get caught in a repeat C-section because VBAC is not supported. Once again, this is why we are here today. Basically, this is a state of emergency. It's showing that our population is not healthy in terms of what's happening to birth. There's something very wrong. Now, in the Maldives, we have very limited support. As I mentioned, we have limited evidence, like the evidence practice gap is very large in the Maldives. And that is actually important because having access to medical staff who will genuinely support your VBAC attempt is one of the single most important factors on whether you have a successful VBAC or not. You can't plan for VBAC in a vacuum. You can't not plan for VBAC and then go in on the day and decide you're having a VBAC. It may end up working, but that's not the way to do it. You, first of all, need a provider who is at least willing to support you and hopefully advocate for you. Now, you can also advocate for yourself if you are educated around what you are going to encounter when you go in. So we'll come back to all of this. I'm just giving you this very general overview to begin with and setting the context. So I want to talk about the mother and the baby. The mother-baby dyad, this is what's called. completely lost in all the clinical language around birth. The mother and the baby are not two separate entities. They are not two separate patients. One is not more important than the other. Yeah. They are one. They are one being. So this is the thing that informs everything that I do, that underpins my entire approach, and also the approach of Mothers of Maldives. The mother and the baby are one being. So from the moment of conception, pregnancy, birth, into postpartum, they exist in this interdependent hormonal, neurological, spiritual continuum. What happens to one is inevitably happening to the other. They have one nervous system. And now they have even come out, I believe it was the WHO, I have to double check that, but there's new evidence to suggest that that immediate skin to skin contact for a baby is actually part of their human rights. Their basic human right is to have immediate contact with the mother, because now it is being recognized by modern science how important those initial moments are to that baby's, whether that baby thrives or not. So Mothers of Maldives as an organization, we are not informed by any hospital policies. We are not bound by institutional guidelines or what's convenient for the medical system. We are completely informed by the traditional wisdom of our people and of Ayurveda, because that is the root of our traditional medicine. And we are here to protect the rights of the mother-baby dyad. And we are here because there's nobody doing this specifically for Maldivian women, which is why we're called Mothers of Maldives. And because the mother-baby dyad is under attack, basically, if you look at the way birth functions in a hospital, I think you will come to the same conclusion. Maybe you can, you're always welcome to disagree with me. I know I can seem a little bit anti-medicine. It's not that I'm anti-medicine, I'm anti the way it's being practiced, because it's not actually informed by the current evidence. So they need to do some catching up. So my story, I'll just tell you very briefly about my story if you don't know much about me. So I currently live in Australia, which is why I had the greatest blessing of my life to be able to have all three of my babies at home. And that's what really initiated me into the spiritual dimension of birth and how powerful and profound it is for the mother that you become on the other end of it. And I have seen this with women, as I practice, I watch women transform. I'm not just speaking from my own experience, I'm watching other women transform. I see them before they give birth, I visit them after they give birth, and I see the transformation. Like my client who had her successful VBAC, she's a different woman now. She is a completely, yeah, it's just so powerful to see that transformation. That's why I do this work. And when I do this work, it heals something in me, because, and I won't tell my story in too much detail because I have already done that in other formats. So if you want, you can go to my website and you can check out. I have a book that I wrote about my birth story, my third birth, which was a free birth, no midwife in attendance. I planned for a free birth and I had a free birth, but it did end in hospital transfer. So I got both sides of the picture. I got to experience completely undisturbed physiological birth where no one showed up for me except the spirit of my grandmother. Yeah, I have goosebumps even now when every time I talk about it, which is why I had to write it down, because it makes me emotional talking about it. So you can read my story if you want. And I also got the other side of it where I was in the hospital, lights and sirens to the emergency room, operating theater, injected with syntocinon, various things, surrounded by medical professionals, having to advocate for myself mid-birth, and it was like a horror movie. And I also got to then experience what birth trauma is, because I hadn't really had that experience before with my previous two births at home. There were degrees of trauma involved in my second birth, but nothing quite like being inside the hospital and being in that emergency situation. So that's kind of what opened my eyes to what women go through in our country just routinely. This is the only option for a lot of women in the Maldives. And that broke my heart, because it took everything that I knew. I had already been training to be an Ayurvedic postpartum doula. So I already knew how to look after myself after birth. I already knew how to feed myself. I knew how to do belly binding. I knew how to do, massage. I knew how to heal my body and what my body needed after birth. Then I had to apply every single thing in that toolkit in order to heal, just to heal from the trauma of my experience. And then that makes me think of women who don't know. They just, don't know how. They don't know why. They don't know what they need. Their body needs. All they are left with is trauma and a society that simply doesn't hold space for that, doesn't accept that that's trauma that needs healing. And that's, another reason why I do this work, is because that breaks my heart. I can't, yeah. I'm getting a little emotional. I knew I was going to get emotional. That's why I have my notes here. Okay, let's move on to the next slide now. So let's look at the three pillars of VBAC success: mindset, body, support. They're not separate things. They all come together. They're all like inside each other in concentric circles. So when you prepare your mind, it helps your body to open. And when you prepare your body, it gives the mind the confidence that you can do it. And the right support is what holds everything together. And we're going to go through each one of those pillars, and you will have a clear picture of what VBAC preparation actually looks like, not just in theory. Now let's look at mindset. This is possibly the most important factor. So when a woman enters labor afraid, her body releases cortisol and adrenaline. These are stress hormones. These hormones actively inhibit oxytocin. Oxytocin is the hormone that drives labor. This is like in the driver's seat. Basically, stress hormones kick oxytocin out of the driver's seat, and it slows down your labor. And sometimes it can even stop. This is actual physiology at work. And then you also have the opposite, which is true. So when a woman feels safe, seen, supported, oxytocin can flow, labor can progress, and the body can open. That being said, women can and do give birth whilst in a coma. Now, in Ayurveda, we understand this state as sattva. Sattva is like when your body is in a state of harmony and balance. It's luminous clarity, pure presence. So this is the state the body needs to be to give birth well. And it can be cultivated. It's not just luck, it is all in the preparation. Now, my client, as I told you before, she had attended many births professionally as a medical professional. She told me that the most valuable thing that our sessions gave her was the understanding of the emotional and energetic landscape of labor before she entered it. She knew what the different stages were going to feel like, and she recognized them when they came. And that's what gave her the confidence on the ground to stay in her body rather than fight it. Now, that is real mindset work. And that's what's available to you. That's how you navigate VBAC. Now, your body can be prepared. I will be running a group workshop in August on Ayurvedic birth preparation, but I can also run this one-to-one if you need it sooner than the end of August. So this is like basically, this is what I teach women. It's having this conversation, about why around spontaneous labor and why that's so important, what that looks like, how your body can be prepared using traditional Ayurvedic techniques, because there are actual specific things that you can do. There's breath work. There's, it's almost like I like to think of it as biohacking your birth, for want of a better term. But there are little ways in which you can train your nervous system to recognize safety before you head into birth itself. So, and there's ways to prepare the perineum as well. There's ways to prepare the yoni so that you can minimize your chance of tearing and stretching. If there's something that you are really afraid of is tearing, then we can work on that specifically. And obviously the diet is very key. Sattva is achieved, the state of balance is achieved through specific dietary changes. And all of those things help to build the tissue in your body and help to build your vitality and life force. And that's what you need. You need strong vitality and strong life force for your body to function, as it's meant to function, as it's designed during labor. So now let's talk a little bit about the environment. Now, having continuous support through labor may not be accessible for a lot of women in the Maldives. However, according to the Cochrane Review, this is one of the most respected bodies on birth research or medical research in the world. This really supports the reduced likelihood of cesarean section, continuous support. Now, this is completely absent from the hospital system. You're not likely to have the same midwife continuously through your pregnancy or even through your birth. So that means your support needs to come from the people you bring into the room with you. And fortunately, you're not. That means probably your husband. Doulas don't exist, so let's leave that aside entirely. Unless you're working virtually with the doula, then that's a possibility. But any relatives you're bringing into that room will need to be prepared. They need to be educated. They need to understand what you want for your birth. They need to know what your birth plan is. They need to know what interventions you're going to be facing, whether they're routine, whether they're necessary. They need to know how to buy you time, because sometimes during labor, you will be nonverbal. You won't be able to communicate what you want. So someone needs to do that for you. They need to be able to advocate for you. And unfortunately, some of the stories I hear from women is that family members even like put the birth itself aside, but even when they turn up with you for medical appointments with the woman, sometimes they just defer to the doctor against the woman's expressed wishes. I've had a couple of women tell me specific incidences where the family basically ganged up on her because they thought she was just being difficult when she didn't want something, and she was clearly stating her reasons why, but she had to accept it. And this happened to a couple of women. So the women ended up having to accept the interventions, and this is not even during the birth, this is just during routine medical examinations. Because the family backed the doctors instead of backing what she wanted. Now, I'm going to be very clear. That is not support. That is abandoning you when you need advocacy the most. And this is why I offer partner education sessions where sometimes I know it's hard for you to it might be hard for you to talk to your husband about these things, but if you need someone else to do it, I will be that person and I will explain to both of you. You can choose to have your husband in the session with you or whoever's supporting you in the birth. And then they can hear from somebody else outside of you what you need for your birth. And this can be a very powerful way. And it doesn't have to be me. It can be someone else. You might have someone in mind already. There are plenty of doulas out there who work with women virtually, like I do. So you can always go with that option of having someone else explain to your husband or your partner or your support people what happens during birth. um, and that can be a very effective way to make sure that your support is up to speed on what you actually need. Now let's just look at the risks around VBAC. So this is the most common risk that is cited for VBAC is uterine rupture. And so I'm going to give you some real talk on this. Now, there was a reel I recently shared by Dr. Stuart Fishbein. I'm sorry if I pronounced his name wrong. He's the host of the Birthing Instincts podcast and a friend of mine. And he basically breaks down the actual risk. He's an obstetrician, by the way. So he basically breaks down what this means. So, I mean, the word itself, as he describes, rupture is not the right word. It's called dehesion, where the scar basically comes away from the wall of the uterus, or a separation, partial separation of that scar. And, when you say rupture, as he says, it sounds like some kind, like a tire blowing up on the freeway, as he says, but that's not actually what it looks like. And that's important to know because you are being presented with this as the risk. In your mind, you might have this idea. And as we mentioned earlier, mindset work, that's half the work done. So looking at the actual risk versus what you're being told is a really good way to determine the true nature of something, right? So here are some ways you can increase your risk of uterine rupture. So synthetic oxytocin or pitocin, sometimes also called syntocinon, is one of the major factors that increases your risk for uterine rupture. This is used routinely in almost all vaginal births in the Maldives and many places around the world, unless you advocate for that, against it. And this is also why spontaneous labor matters so much, as in not having an induction. Induction increases your risk of uterine rupture quite a lot because of the methods that are used. So methods such as the progesterone method can increase your risk of specifically of uterine rupture. It's important to know all these things because most likely if you are going for a VBAC, and this happened to my client, you will be offered an induction. They will steer you towards having a medically induced labor as opposed to waiting until your labor starts spontaneously. And often if you go over the due date, you'll most definitely be pressured into an induction. Now, another thing about due dates that I will mention, honorable mention to due dates, only 4% of women give birth on their due dates. It is not an accurate picture of when you're actually due. Many women go beyond 42 weeks. A lot of women give birth past 40 weeks when you're waiting for spontaneous birth, when you wait for the body to do its own thing. It will often go beyond 40 weeks. It's normal. I myself gave birth. 2 of my births were over 40 weeks. So it is not actually a reason for pressuring you into having an induction because, and this is crucial if you're going for VBAC because of the risk of uterine rupture. Let me just check if I missed anything. Yes. So another risk is how short the inter-pregnancy interval is. That means how long ago did you have your C-section? So if it's less than 18 months between your cesarean and your next birth, then that's a real risk factor that you will need to weigh up. And discuss honestly with your provider. That being said, it can be done. Doesn't automatically exclude you from VBAC, but it's just something you need to approach with open eyes, and it needs to be tailored to your specific situation, and it's not a blanket yes or no, if that makes sense. It also depends on the type of incision that you have. So if you have a classical vertical incision, that's a significantly higher risk than if you have a low transverse scar. A lot of women, I believe, have the low transverse incisions these days. But once again, depends on your specific situation. Yeah. And if you have had a short interpregnancy interval, then it's best to reach out to me for a one-to-one consultation so we can go over all the specific factors in your situation, basically. So this is where this kind of personalized guidance matters the most. So both paths carry risk. It's not about VBAC being perfect and cesarean being wrong. We are looking at nuance. And the right path, as I said, depends on your situation. What I want you to walk away from the session with is this. The decision is yours to make, made with full informed consent, all the information. That means you are consenting to something with all the information. And it's not being made under pressure. That's why you're here. You're already removing the pressure factor by being here, by considering your specific situation and all the risk factors. So, yeah. And as I said, there is an evidence practice gap. So there are limitations to the system. But this means that your education is crucial here, which is why you're here. Okay, so let's get practical. And I want you to walk away with 3 steps you can take today. So firstly, before you do anything else, do an honest risk assessment. All the questions you need to ask. What type of incision do you have? So do you have a low transverse incision? Do you have a T-shaped incision? If you don't know, you can go back to your place of birth and request your notes. You can submit a Freedom of Information request, get your surgical notes from them. They should have them, hopefully. So how long has it been since your cesarean? If it's less than 18 months, then it's worth taking the risk factor seriously. Do you have access to emergency C-section facilities if needed? Are you in a regional area? So that's a practical safety question, because even if you go for a VBAC, there's no guarantees in birth. Even if you're going for a free birth, as I told you, my story ended in a hospital transfer in the operating theater, and that was what I was trying to avoid, the medical system, you know. I ended up delivering myself into the belly of the beast, basically. You know, there's no guarantees in birth. That's what I can tell you honestly. And do you have a provider, or can you find a provider who is genuinely willing to support a trial of labor? This is the term to use, trial of labor. That means they're willing to let you try for a physiological birth before going for a C-section. There is a difference, you know, it makes a big difference. And of course, if you have any other health factors that might impact your specific scenario. Now, let's talk a little bit more about spontaneous labor. I've said a lot of this before, but I just want to show you some of the data. So the body has a particular design when we So when we have the Ayurvedic birth preparation workshop, I will be going over the physiological states of labor as well as the energetic stages of labor. Labor isn't something that is chaotic. It has a specific design. It follows a specific pathway. We know this now. People have studied birth long enough to know. Contractions build gradually. Oxytocin flows in a rhythm. The baby rotates and descends. The baby initiates labor when the baby is ready. And the scar is generally under the kind of pressure that it can handle. Now, some of the things that will change this, as I mentioned, the use of synthetic oxytocin because our bodies don't recognize it as the same. Contractions are stronger. Synthetic oxytocin, because I was hooked up to synthetic oxytocin. And I can tell you the afterbirth contractions are much worse when you have had Synto or Pitocin. The contractions during labor itself are chaotic and less rhythmic. The scar comes under different kind of pressure. And, you know, if the body has these built-in checks and balances as you go through labor, with synthetic oxytocin, you are overriding a lot of those things. And this is why my very first recommendation for VBAC is to wait for spontaneous labor. So this is where you're going to need to plan for that. So you need to talk to your provider, whoever that is. Talk to them early on, as early as possible, that you want to wait for spontaneous labor. You want the opportunity for your body to go into labor. You do not want to be induced. Once again, not a medical recommendation, by the way. Just presenting evidence. Okay, so let's look at the cascade of interventions. Now, this is where having a concrete birth plan is vital. A birth plan is not like a wish list. It's like a map of the terrain you're about to enter. You've written it before you go into labor, so you don't have to make any decisions on the spot under pressure. Before you have the factor of pain of your cervix opening, and you're surrounded by strangers in scrubs and people telling you, you need this, you need that, someone's putting a hand up your vagina. Make your birth plan before all of that happens, yeah? So for VBAC, this needs to address the cascade of interventions down to every detail. This is what I did with my client. And this is what we do in the one-to-one session when we do birth planning. I write your birth plan. We go over every single step. So you don't have to try and figure it out on your own. So every single intervention that you will encounter during a VBAC labor can change your risk profile. So this isn't just about, you know, ticking a few boxes on a generic birth plan. This is not just, do you want continuous monitoring? This is like, under what specific circumstances would you recommend continuous monitoring? This is the question you need to ask your provider. When would you put me on continuous monitoring? Can it be avoided if at all possible so that you can move around? Are you going to be allowed to eat or drink during labor? What kind of, are they going to do an artificial rupture of membranes? What method are they going to use? Is it a balloon catheter? Are they going to give you progesterone or prostaglandins? I think, sorry, getting my words mixed up. You know, what's the protocol for augmentation during the trial of labor? And at what point are they prepared to override your own best wishes? And this is what we went over, me and my client, and which was a very significant factor because even though she had attended births before, she knew what they did in hospital when to women who were coming in for labor. She knew what it looked like. She was doing those things herself. Even though she knew all that, she knew the physiological stages of labor, she was so well educated. This was so important. This going over every single aspect of her birth plan was so important to her confidence when she went in for labor. That's the level of preparation that you can do. You don't have to, obviously, but in order to improve your level of success with VBAC, this is the level that you need to go to. I'm not saying this to scare you. I'm telling you this because this is what I have seen works. Now, finding your provider, very important. We know from anecdotal evidence, Treetop Hospital definitely has providers that support VBAC. And IGMH has people within the system who have had VBACs at IGMH. ADK, I am not getting good vibes off of at all. But what this looks like, basically, my recommendation to you, because I'm not in the Maldives, I can't do that. I have written to every single major hospital in the Maldives to try and get this information. I have submitted freedom of information requests, but the only people that responded was the Ministry of Health with the data that I requested on birth, interventions, rates of C-section, rates of induction, rates of episiotomies. I requested all of this data. And from each individual hospital, I also requested their VBAC policies. I've not had a reply. So you might need to do this part yourself because you are there. So what this looks like is talking to your providers, talking to whichever hospital, maybe call all of them, ask them, have they supported VBAC before? Who has supported VBAC within the hospital? Can you make an appointment with those doctors who have supported VBAC before? And then go from there, if that's possible. If not, then yeah. It's not so much. So when you go in, it's not so much asking, am I allowed to have a VBAC? It's, I am planning a VBAC with this birth. How are you going to support me? So do you see the shift there? It's not going in with, please, sir, may I have a VBAC? No. You have decided when you're going in, you are going to try. Whether you're successful or not, that's another thing. We're going to talk about that later as well, because I have some good news for you there. It's not about being given permission to VBAC. It is, I have given myself permission because I know my body can do it. That's what my client said. So it's a different approach. It's a different level. It's a different layer. And you will be met with a different response than if you go to them going, please, may I have a VBAC? Can I have a VBAC? They will probably just say no, because you don't have that confidence that you're coming in going, this is what I'm going to do. And here is my list of questions that I'm going to ask you. And you are going to give me answers to all of this. Now, if this is truly an option for you, and I know this is very rare cases, if you can travel abroad, I have heard from a few women now that Birth Village in Kerala, India is amazing. Fantastic birth center, access to the most beautiful midwives. Women have had beautiful VBAC experiences there. Go check them out on Instagram. They're doing incredible work. So I know there are Maldivian women who have traveled specifically to give birth at Birth Village. If that's an option for you and you haven't heard of it before, then I'm telling you now. But I know that it's not always an option for a lot of women to travel. And if you know of other women, maybe you have women in your family who have VBAC before, or if you know friends who have even tried, talk to them about their experiences. What did they find? Get as much information as you can from women who have been through it. And this is where building your support team really matters. Like I said, your partner needs to be educated. Not just like supportive as in they come to your medical appointments. They need to know your birth plan intimately. And they need to know when those interventions are being offered to you, is this something you would agree to? Because like I said, you may not be able to communicate. And if it's not something that you would agree to, they need to buy you time. They need to know how to buy you time because it can be done. Yeah. And if you can access a doula, virtual doula of some nature, doesn't have to be me, anyone that's willing to support you, who has done this before, who knows the terrain, who can craft a birth plan with you that is your birth plan, please go for that. Please take support where it's needed. Um, of course, you can do this on your own. Of course, you can. I truly and 100% believe in every single one of you that's here who is planning and wanting to go for a VBAC that you can do it, whether you are supported or not. But I am also here to tell you that support is very important because you will have doubts. There will be a lot of doubts, especially when the system is stacked against you and you are being told that this is not good for you, it's not safe, you're putting your baby in danger, you're putting your life in danger. You need people on your side. So get support. It doesn't have to be your husband. If your husband is the only person who can enter your birth space, then, sometimes there are no ways around that. I don't know what your specific circumstances are or how your relationship is, but even if it's a friend that you can sit with and talk with about your doubts, talk with about what you want for your birth plan, someone who can reflect those back to you, even if it's someone who will role play with you and say, oh, I'm coming in as the, labor ward nurse. I want to give you a vaginal exam. How are you going to respond? If you've got someone in your life who's willing to practice that with you, that's beautiful preparation work you can do, and it will empower you. So now I want to talk a little bit about Ayurvedic birth preparation because there are very specific ways, as I mentioned, where you can actually really deeply prepare your body for birth using ways that modern medicine is only just catching up to. In Ayurveda, they have known this for centuries. These methods are enshrined in the ancient Hindu classical texts, the Charaka Samhita, and this forget what the name of the other one is, but it's a whole modality, and there's rhythms, there's body work, there's herbs, there's specific foods that are taken at specific times. It's really quite beautiful. There are blessings that are given, ceremonies and rituals that are conducted at certain times. So, women weren't just left alone when they were pregnant. They were taken along the journey with full support from Ayurveda, from the community. So there's specific herbs for supporting cervical ripening. Things like dates, eating dates have been shown in scientific studies now to improve your, the rate at which your cervix opens. There's ways to support nervous system regulation with Ayurvedic herbs. Uterine tone, you might know red raspberry leaf, very commonly cited in a lot of birth preparation. There's also ways to prepare the perineum and the yoni. And these are all methods that I used myself, and I can tell you they work. There's something called yoni pichu, which uses warm oil just to prepare the yoni so it can actually stretch because it's designed to stretch to accommodate the head. I laugh when I hear people say, oh, the body is not designed to support this huge head that's coming out of you. No, the perineum will stretch. Absolutely. I know this from 3 times I have given birth. 3 times my perineum has stretched. It has not ripped, it has not torn. So I can tell you that it works. There's breath work or pranayama, as it's known in Ayurveda or ancient, in yogic philosophy. that can really help to train your nervous system to find safety and to find calm. So I teach a very specific breath work technique that you can use whilst you're in labor. And everything I teach you use right up until you go into labor. So you train your body as you go along. And I teach this in the workshop. As I mentioned, mindset work, understanding that comes from education, knowing what's happening to you, through you, within you. So you recognize what your body is doing rather than fighting it. Because when you resist, that's when things get difficult, when things get hairy. And there's dietary optimization, there's ways to increase your blood volume before you go into labor, so you don't lose as much blood, or if you lose blood, you still have enough reserves, because the best way to support breastfeeding, as Ayurveda has known for thousands of years, is through building the blood. So I teach that as well. This is a limited entry. I'm trying to say that I'm only going to be allowing about 12 to 15 women into this workshop, because I want to make sure there's time for one-to-one support as well. So spaces are limited. This is what I've been trying to say. Oh my goodness, I've been talking for a long time. Yeah, and it's not just for VBAC, it's for vaginal birth in general. There's scar mobilization work you can do. There's ways to strengthen your scar, strengthen the tissues around it. And of course, there's pelvic floor therapy. However, I would be a little bit hesitant to recommend that if you're already pregnant. Okay. Now, this is actually the biggest thing I want you to take away from this. Forget everything I just said. Whatever happens during birth, it can be healed postpartum. I know this because I did this for myself. So, however your birth unfolds, like I said, there are no guarantees, especially because you are going into one of the most difficult and hairy terrains for VBAC in the world. You're going to have to be a warrior, and it can feel like when I had my traumatic free birth experience and it ended up in transfer to the hospital, I felt like a failure. I felt like this great big fat failure. God, couldn't even do it. I tried to free birth, ended up in the hospital. So I know how that feels. It can feel like you're just basically falling down a well, and there's no end to it. However, postpartum, this is the portal that we are gifted. It is not a new kind of hell, as every influencer out there wants to tell you. Postpartum is awful. It's so hard. Be prepared to be unsupported. Be prepared to be alone. I say no. Plan your postpartum. Plan to have a healing postpartum. And whatever happens during birth, you are covered. That's your insurance policy. Because you can heal whatever happens. There are ways in Ayurveda, the way to heal birth trauma, the most powerful method to heal birth trauma is through self-massage, through the power of touch. And that's what I did after I gave birth, and I ended up in the hospital. I came home. I did the body work. I did belly binding. I ate a specific kind of diet, because when you don't eat foods that your body can digest in postpartum, it actually affects how you feel. Your anxiety levels, postpartum anxiety is like a whole different kettle of fish. If you've ever been through that, if you've ever been through postpartum depression, you know this in your body. It is like nothing else. And one of the things that makes that worse is when you're not eating properly. Our digestion is completely different after we give birth. So this is why Ayurveda recommends a very specific diet. They don't just say eat, whatever people are bringing to you. No, no, no. You have to eat this type of food. It has to be well spiced. It has to be very rich in fats, things like ghee. If you can take ghee, this is the best medicine. Basically, oleation, the application of oils and fats inside and out, is what's going to soothe your nervous system and reduce your healing time, basically. It enhances your recovery. My best friend was watching me recover. She knew the story. She was watching me from the Maldives. And she said, I can't believe how quickly you are recovering after what you've been through. I can't believe you're up and about. You know, it's amazing. It's amazing. Even people who are so far away could see that it was miraculous, the healing process of that postpartum can actually give. So I'm seriously not like I can't understate this or overstate. I can't stress this enough. Whatever you go through during birth, you can absolutely 100% heal postpartum, but you need to plan for it. You need to educate yourself about what your body needs postpartum. So, yeah. And unfortunately, we live in a society where there is no understanding, there is no village, there is, people expect you to just get up and bounce back and carry on. The idea of birth trauma makes people uncomfortable. This is why you have to take responsibility. And I'm so, like, I feel sad because I have been in your position. And I remember thinking, oh my goodness, it's all up to me. Why is it all up to me to do all this? It is. At this point in history, it is up to you. But that's why you're here. You're not the usual kind of woman. That's why you're here. Because you already are on that path. And 100% because you are here in this workshop or you're watching the replay, wherever you are, you can do this. Okay, so let's just open up. Do you have any questions for me at all? So feel free to unmute yourself if you have any questions. I'll just give you a few moments. Nobody? That's all fine. That's fine. That's fine. I was asked a question recently about, I think it was last week. There was a woman who wanted to know about whether she could have a VBAC because the doctor was saying no. She had only had her cesarean, I think it was 8 months ago. So once again, I went over this earlier. It depends on the type of scar you've had. And also, it does depend on whether you can find a provider who is willing to support you and whether you take the scar healing factor, whether there were any complications with the scar healing. It's a very individual process, but it is possible. You can have a VBAC even if you've had a short intra-pregnancy interval. However, there is a higher risk. So that's something that you just have to be, prepared to take. So if there are no questions, I'm just going to close off the session because we are at the end of our time together. So before I close, I just want to say that whatever reason you're here, your body is not broken. You may not have had the support, the time, the birth that you wanted originally. but 60 to 80% of women who attempt VBAC will have one. And those are real odds, and it requires preparation. And I watched my client go through this process, not just the birth itself, but the preparation, because we were together. I think she came to me in her second trimester, and we worked closely together. I was with her all the way up until the birth and even afterwards, via distance, obviously. But the education, the planning, the reclamation that she did of her own birth journey, she said it was the most healing experience of her life. I had moments of like real tears, because birth has that capacity to heal. If your previous birth has wounded you, this one can be how you recover. This one can be how you heal. And even if you don't end up going forward from here to have a VBAC, or even to attempt a VBAC, and you go and have a repeat C-section, that key piece I mentioned earlier about healing during postpartum, that is valid. That is where you can heal and you can set yourself up. In Ayurveda, the foundational belief for postpartum care, that underpins the entire modality of Ayurvedic postpartum care, is that whatever happens to the woman in the first 40 days after she gives birth is going to set her up for the next 40 years of her life. So it's a really big deal. And that's why it matters. How you give birth impacts how you go into postpartum, and that impacts how you go through motherhood for the next 4 decades. So, yeah, that's me. That's my presentation. I'm Hatija, birthkeeper, representing Mothers of Maldives. We are here to give you honest birth education, not medical advice, simply woman to woman. And if you want to go deeper, you can book a one-to-one consultation with me. I have very limited spaces because I don't have a lot of, I also have another job where I work as a postpartum doula in an Ayurvedic spa. And I also attend women after they give birth in their homes as well. So I offer in-person postpartum care here in Adelaide. So I have very limited spots for virtual support, but I am here. If you need support, I am here, and I 100% believe in your ability to do this. Not just in your ability to do this, but in your ability to have an empowering birth experience and to heal from that experience. Now, one of the things that we are doing as part of Mothers of Maldives, we are trying to get more information about the birth experience of women in the Maldives, because, as I mentioned, I have submitted freedom of information requests to the ministry, and I discovered that they are not actually tracking a lot of information, so we're going to do it. So we have this Maldivian birth experience survey that I've put together, and it's not clinical data or quantitative research. This is qualitative research. We're trying to find what women are experiencing and going through. We are actually interested in how you feel when you go through birth and postpartum in the Maldives. And the reason we're doing this is because we need this information so that we can make policy recommendations at an institutional level, because the hospitals are operating with outdated policies, and that, frankly, they are leaving themselves open to litigation at this point. So we want to bring in some recommendations that will actually change the birth experience for women, but we need to know what that experience is to begin with. So I will be sending out an email with the replay, so you can go back and watch this if you need to, but there will be a link for the birth experience survey. If you have 10 minutes, if you have given birth in the Maldives before, if you know other women who have given birth in the Maldives before, send it to them, fill in the survey. Please help us collect this data, because we're doing this for women. We're not doing this for anyone else. And it really does, it is going to make a difference for the future generations of mothers. because we need to turn the ship around. It's urgent. We are here to reclaim birth as a collective, as a people, as Maldivian women. So, whatever you can contribute in any form, just fill out that survey. It would mean so much to us going forward with this project. So, yeah, that's it. Thank you so much for joining me. I hope I've answered some of your questions. Once again, if you have any further questions, you're so welcome to email me. Once I send out the replay, you can just reply to that email. Otherwise, I'm on Instagram. I'm doing some things that make me uncomfortable, which is talking to the camera and stuff on Instagram. And I'm actually telling the story of the colonization of birth at the moment. And I've been working on filming those episodes. So if you are following me on Instagram, jump on there and help me spread the message, share, repost, save, all of those things that help us reach more mothers so that we can get this information to the women who need it. So thank you so much for joining me. I'm going to sign off now. And yeah, all the best with everything. And I really hope I get to connect with you one to one. Even just drop me a message sometime. I would love to hear your feedback on this session, whether there was anything I didn't address that I can address, because I want to do more of these in the future. And I will be running them along other themes. So if there are specific things you want to learn about, please let me know. And yeah, we'll go from there. So once again, thank you for joining me.